Hi, this is Ed Tracy, and this is another segment on healthcare from Indiana, where we've been spending the day here. And today, I'm here meeting with different groups that are part of Dr. Patel's new access to healthcare model. And we talked already to the Human Resources Director and former Director of the school board here, the school department. We've talked to the sheriff and how it's benefit him, and we've also talked to the 3 county commissioners of this county, and now we're going to introduce you to private industry. We have Dennis Hanshoe here, who is the senior manager in human resources at Advix, and you're in the auto industry. And welcome, and appreciate you coming out today. Dr. Patel, give us a little bit of background of how you came to going from the public sector with your wellness center to then inviting in a private company. How did that fit together?
You know, like we talked earlier, we originally started out with the larger employer model, where we can provide them a full 40-hour work week clinic. And once we initiated that, it was successful. Then we had smaller company owners, which are 400, 500, 600 employee pool, and such as Dennis's company, Advix, where we could provide them a complete 40 hours work week clinic, but it's not viable financially because of the size of the company. So we actually did a co-op model concept to aggregate 3 or 4 companies, put them together, and have that volume that would justify the 40-hour work week. So our first client was the county employees, and we started that unit with 18 hours of coverage in a 7-day period, which is really not what you want. That is not a full running clinic. Knowing that we will look out in the community to see who wants to join us. And Dennis and I have been having conversations for quite some time now, and looking at various scenarios and cost-benefit ratios and whatnot. And when we introduced this concept, of course, it was a win-win for everyone now, where he can bring in 20 hours of work week financially. The existing county has about 18 hours a week financially because of the size. Collectively, now they have nearly 40 hours of coverage. And so now the doors are open for them for 40 hours. So in a way, they got a better deal. It was better off. They were small in a way now, because now they have 20 hours of free coverage, and they're only paying for 20. The other guys are paying for 20, but you got access to their employees 40 hours a week.
And really, you have 24/7 access, but the doors are actually open for this 38, 40 hours, but all the employees have access to your phone number and can be treated after hours and weekends and all of that as well, correct?
That's correct.
Yeah. So, Dennis, tell us when you decided to make the jump. When did it become financially feasible for you, and were you just wanting to do it like Dr. Patel said, and then all of a sudden you saw now's the time, or how did you make that bridge, cross that bridge?
Well, to give you a little better history, I actually started looking into like our own clinic about 7 years ago, okay, and looking at ways to kind of take out what I consider to be the middleman in the cost of healthcare. Our healthcare costs are now up to about $4.2 million a year, and for our company, that's a pretty sizable amount of money. And so we were looking for ways to cut costs. That was the initial reason we looked at our own clinic. We were never able to do it because, like Dr. Patel said, we were just not large enough. At that time, we had about 400 employees, and we just weren't able to do it. Our corporation, even though we have several plants in North America, they wouldn't allow one individual plant to do it. We weren't large enough to have the cost involved of building out a clinic and also to staff it. So then about 2 years ago, we met Wellness for Life and Dr. Patel and started talking and exploring different options. And but about that time, well, actually it was a little more than 2 years ago. It was about the time the economy crashed, and again we were looking at it again. looking at possibly starting one for us, and then at that time we weren't able to do it because of the economy. And then recently, when the county started up, they built out their own clinic. They reapproached us again and said, you know, would you like to join? And our corporation said, yeah, you know, let's see if this model works. And so about 3 months ago is when our employees finally got the opportunity to start going, and it's been a big success so far. I think our utilization's already up to over 50% of our employees.
In the first 3 months?
Yes.
Wow.
Yeah, it's been very heavy. In fact, I think from talking to Dr. Tell and their staff that we actually are utilizing it almost more than the county is already within the first 3 months. So our employees are excited. 35 to 40% of our employees don't even claim to have a primary care physician, which I'm finding to be more and more the case in this day and age. And so they love this.
So you are providing a healthcare plan for them,
Right.
but they just don't access it or use it because there's some barriers to them to use it, correct?
Right.
What are those barriers?
Barriers, it could be, I mean, things, number one, just having the money to pay, you know, the initial co-pays or the initial deductibles, the ability to get in when they want to get in. You know, we've talked earlier, you know, around the table at lunch about, you know, the use of emergency rooms, and we actually had one family unit use the emergency room 27 times in 2011.
Wow.
And so, you know, we're trying to find ways to offer resources to where they're getting ongoing care and taking care of, you know, kind of like as an example, we're in the car business. If you do routine maintenance on your car, it lasts for a lot longer. They're lasting 150, 200,000 miles now. And the same with your body. If you take care of it on a regular basis and make sure that you're getting your routine checkups, you can have a lot better chance of having good health.
The barrier has been can't afford the co-pays, multiple co-pays, maybe off the same visit, like we talked about with the other group. Might be a co-pay for prescriptions. What if you need 2 prescriptions? It might be two $20, $30 co-pays there. You plus the doctor visit, plus labs. You can walk out of doctor's office and a copay a couple of $100, and for somebody who a blue collar employee who's living paycheck to paycheck, you know, they're thinking about, gee, groceries, medicine, doctor. I gotta wait till the next paycheck. If I have to wait till the next paycheck, I'm only going to get sicker. And so do you, the other groups have all said productivity has increased as a result of getting same day care. The anxiety of getting health care has gone away because there's no copay. They can just go visit.
Well, I know when Matt Burris, that works for the company, did most of our education sessions for us. We were able to hold over about a 3-day period small group meetings with all of our employees about what, you know, the clinic as a resource and what it could mean to them. And that was one of the big selling points, was that you have access, you have immediate access, you know, you're not going to have to get your wallet out. And I mean, our employees are feeding back to other employees already. Man, it was great. I didn't have to wait. Staff is great. They're really good to me. They're very friendly. They got me in and out, and I never got my wallet out. You know,
I like that.
I got my medicine. I got my labs done, and we've had a lot of people too that have chosen to keep their family physicians, but they'll have them fax orders for lab tests to the healthcare clinic, and they're able to go get the lab test done at no cost. So even that is a savings.
Wow.
Even if they want to keep, which we're not trying, you know, to come in between, you know, whatever
Their physician.
relationship you have with your clinic or with your primary care physician, but it's still another resource and an access to save you money. And when we went into it, we kind of looked at it as if, from a company standpoint, if we could even break even, it would be a benefit. And it's been an employee morale thing, because our employees are cutting out their own out-of-pocket costs. And that's been really big. I mean, you know, yes, they're still paying their insurance premiums, but over time, we're hoping that, you know, as this thing continues to work, that we'll be able to even maybe keep our premiums the same, or we only went up about 2% this year, and we're hoping that, you know, we can even keep it even, or maybe, you know,
Get
drop
some
it a little
savings.
bit. Yeah, so.
What's your expectation as far as productivity goes by utilizing this?
Well, we actually have seen a slight drop already in our absenteeism, and we're still kind of early to really see a lot.
You're going to go through your first real winter,
Right.
with colds, flus, and all that.
Right. But I mean, one of the things, I mean, we just last week started offering flu shots to all of our employees plus their families at the clinic, and we could also, they're more than
With no copay.
no copay, yeah. And they're more than willing to come out to our plant and, you know, do it there on the plant site too for a few hours that we can do for, so people don't even have to go to the clinic.
Because people work close together in your plant,
Right.
don't they?
Yes.
So somebody gets sick, and you could have a sick out within a week.
Right.
Right.
Yeah, and I think again, I mentioned around the lunch table today with the group that we were talking with, that we even have employees, you know, on an assembly line next to each other. If somebody starts coughing or sneezing, they'll say, here's the number to the clinic, why don't you call it and go after work and get in, because the hours are open are good. They're even open, you know, for 4 hours on Saturday. So
Do you have shifts or one shift?
we have 3 shift operations.
So the people that work at night can go after their shift, and the people who work during the day can go after their shift,
Right.
or before, whatever.
Right. Yeah, it's been wonderful, that part. And again, like I said, I mean, you know, people have said they'll call at 9 o'clock in the morning, and maybe they're in to the clinic, you know, 4 o'clock that afternoon, and that's really been great.
So how many employees do you have?
We're up to 600, about 450 covered on our medical plan right now. So actually, it's a very good medical plan, but we also have about, of that 600, about 100 of those are temporary employees right now. So.
Do you think that this is a good HR benefit to sell employees that would say, come and work for us because your health insurance, you know, we have this clinic, you don't have to pay any copays, and
Oh, it already has been. We definitely have had some employees that have come even through our temporary pool saying, you know, when am I going to get hired? Can I go use the clinic yet? So, in fact, we were having some employee meetings yesterday, and one of them said, how soon can I get on the plan so I can go to the clinic? So yeah, it's
Dr. Patel, how do I get on this plan?
Yeah, I'm not on it.
But it's been really, I've even been a little surprised. I thought it was going to be a good thing, but I mean, the employee morale over it has been even better than I expected. I mean, the positive returns from the employees and talking to each other. You know, we have what we call skip level meetings. That's what we were having yesterday, and where they meet with the vice president of operations and myself, and just kind of an open conversation about work issues, but usually something comes up about the clinic, and you know, there's usually at least 2 or 3 people in every group that says, yeah, it's been great, you know, exactly what they said. I don't have to, you know, I go in, short wait, staff is good, I'm in and out, no cost.
Leave without my wallet being touched.
That's right, I can leave it in the car, I don't even have to get it out except for maybe my ID to make sure that I am employed there.
Right.
So it's been good.
Well, that's great. Dr. Patel, anything to add to this? We're talking now to potential private industry in Georgia and other parts of the country who may want to do this. And you've just heard from a private industry, a good-sized industry in the automobile industry that has struggled over the past 4 years, and they're trying to find ways to cut costs any way they can. But here they not only cut costs, but they improve the wellness of their employees, and they've got an advocate in Dr. Patel with the Wellness Center to help make them well, stabilize their diabetes and other chronic illnesses. So it's kind of like having the old family doctor back from your neighborhood doctor. How far away, Dennis, is the plant from the Wellness Center?
I guess it'd be about 8 miles.
So very convenient, centrally located. so they're not going 30, 40 miles out of the way to, just because you found a deal somewhere. Just so it's not all of those things plus convenient.
Well, in fact, we're even hoping sometime over the next 6 months to a year to have the opportunity to partner with Wellness for Life and maybe a company from our one of our southern counties, because we have about 20% of our 20 to 25% of our employees actually live in the surrounding counties south of our plant.
I see.
And they've been working with a couple organizations down there that we might be able to open, even partner with a clinic that would even give our employees even more access.
So you have a north access and a south access, and they can go to either one.
Exactly.
Correct.
So if they're at work here, or if they're at home there, home might be closer to the other facility.
And also we need to keep in mind about 60 to 65% of the consumers of the healthcare is not the employees, but their spouses, significant others, and the children.
Right.
So where they live, zip code wise, is more important than where the company is located.
Very good. Well, thank you, Dennis. Appreciate you taking the time out of your busy day to come and sit with us
Appreciate it.
and share your testimony.
All right, thank you.
Thank you, Doctor.